We were doing lordosis in the previous video. This is corrective measures of lordosis. Perform forward bending, perform toe touching at least 10 times, perform halasana, perform stoop walking. Third spinal cord deformity is scoliosis. This deformity is an abnormal curve of the spine or backbone in the lateral side. In this, the curve is deviated to one side, the bone of the spine twisted together from C and S shape. This is the shape of the bone. Next is ptosis. Disease in the joints of bone, paralysis, polio, carrying heavy weight on one side regularly. Corrective measures are perform chin-ups, perform trikonasana, hold horizontal bar and twist your body clockwise and anti-clockwise direction. Fourth deformity is of round shoulders. It is the postural deformity in which shoulders are drawn forward, the head is extended and chin comes forward. The shoulders are bent forward, that gives a round form of the upper part of the back. Causes of round shoulder: carrying overload, weak muscles of chest and shoulder, wrong posture during reading or writing, improper furniture. Corrective measures: backward bending, reverse sit-ups, perform chakra dhanurasana regularly. Chakrasana and dhanurasana. Next topic is special consideration for women. Sport achievement entirely depends upon the fitness of the athlete and sport person. Then how can we accept something extra if person is having any natural or internal problems? It is the natural phenomena of menstrual problem faced by every woman in the universe. It is necessary for cleaning the internal organs of the body. Worst of all, the people thinks that if women take part in sports, they will find it difficult to adjust with challenging tasks of sports. Menarche is starting of menstrual in female. The average age of menarche is from 12 to 14 years. It may vary due to genetical, environmental, biological and nutritional factors. Vastly, it is seen that the menarche starts late in the sport women as compared to non-sport women. Causes of early menarche: improper diet, obesity in childhood, high level of stress in childhood, children who remain without the breastfeed, exposure to smoking, lack of exercise. Next is menstrual dysfunctions. Any abnormality or irregularity in the process of menstrual cycle is known as menstrual dysfunction. Menstrual cycle is not systematic in itself. It is an irregular process. Mostly the normal menstrual cycles occur after 28 days and last for 3 to 7 days. Now first menstrual dysfunction is of amenorrhea. Amenorrhea is the absence of menstruation. The absence of menstrual period for 6 months or more is known as amenorrhea. It happens due to intensia, exercise, or on an irregular basis, hormonal changes, eating disorder, medication. Next is dysmenorrhea. A menstrual period accompanied by severe pain or cramps in the lower abdomen is called dysmenorrhea. During menstruation, the uterus muscle contract due to release of compounds, due to which the supply of oxygen decrease in that area leads to severe pain and cramps. Third is premenstrual syndrome. Experiencing symptoms such as pain in back side of the leg or abdomen, irregular mood swings, headache, constipation, emotional stress, etc. Before the set of menstrual period, premenstrual syndrome occurs. A female may have one or more symptoms few days before her periods. Fourth is prolonged menstrual cycle. The menstrual bleeding lasts about 3 to 7 days. These are longer than the normal duration and can occur at unpredictable intervals. Fifth is postmenopausal. This is when the menstrual cycle begins again after the menopause, when menstrual cycles stop permanently. Sixth is eumenorrhea. This is the normal menstrual cycle. In next video, we will study female athlete triad, osteoporosis, amenorrhea, eating disorder.